Hello, everyone. Welcome back to another virtual session. Today we have Dr. Gallagher, and he is an oral and maxillofacial surgery resident. And today he is going to present on his journey and where he is today. And so whenever you're ready, doctor.
All right. Hey, guys. Let's see. Put in presentation mode. All right. Hey, guys. So please, again, call me Brendan. I'm an oral and maxillofacial surgery resident. I'm currently at NYU. I'm in the 4-year track, and I'll explain a little bit of the differences. There's the 6-year track and the 4-year track. The 6 years have an extra 2 years because they get their MD. And I didn't want to do that because I want to work and I don't want to spend more money on getting my MD. And oral surgery, for the most part, 99% of what you do, unless you want to do the cosmetic or the hospital route, it's not necessary to get that MD. So I wanted to go right into it, and I hope I can answer most of your questions here today. So let's get to it. I got the logo of NYU OMFS over here. I took out NYU because they're not sponsoring this video. It's just OMFS. And yes, I did make that logo. So therefore, I got to be entitled to some right to use it, right? Top Professionals is our I co-founded that company with my buddy Sean Czar. He's an orthodontics resident that contains Instagram pages in dentistry, such as Students of Dentistry, Elite Dentists, and Top Dental Practices. We also have law. We have physicians, medicine. We have veterinary medicine, among some others. So why don't we get right into this? Oral and maxillofacial surgery, the residency application process. As you know, the specialist that you go to get out to take your wisdom teeth out, get them extracted, and that's the tooth you could see in the figure on the right there. The specialist for wisdom teeth is oral maxillofacial surgeon. The oral surgeon typically does that. Some general dentists do, some periodontists do. That's one of an abundance of procedures that we do. Overview of this quick presentation, because I want to get right to the Q&A. Is right here. Let's hop on into it. So dental school specialty placement history. Dental schools typically repeat similar placement numbers year after year. For example, Harvard places a lot of dental students into specialties, not just oral surgery, all specialties. You know who else does that? Another Ivy League school. Columbia places a lot of dental students into specialties. Stony Brook, where I went, places a lot of students into specialties. We also place a lot into general dentistry. One of the reasons I chose Stony Brook was because of both of this. The students that go on to general dentistry, they are very trained clinically. They're very trained academically. We start off, the majority of our first year is with the medical school, all right? So therefore, looking at your school's recent specialty placement history can give you an idea of what results your year will likely have. This is only approximation, but this is what I went for, and it proved true. Class rank and GPA. Now, class ranking and GPA isn't everything. Programs, they do want to see you have a high class rank, and they want to see you have a high GPA, obviously, but you don't need to be number one in your class, all right? This is very important to stress here. Again, strong GPA, different schools have different stats. There we go. The CBSE exam. So what is this? Most specialties don't require you to take a separate exam for you to match into their specialty. Oral surgery is different. You need to take the CBSE exam. It's called Comprehensive Basic Science Examination. It's out of 200 questions. It's essentially a simplified version of the Step 1 medical board exam that medical students take. Okay, you schedule about 3 to 5 months out. It's only offered twice a year. That's very important. Okay, scheduling the exam closes about 1 month to 2 months out, so you need to schedule it early on. You need to schedule multiple months out. The most recent stat that I am aware of is that the limit of exam attempts you can take is 6. This is not something you can only take once. All right, you're allowed to take it multiple times. The examination layout is 200 questions, but it's divided up in 4 sections of 50. It's about 5.5 hours. On the right side, that's where you schedule and register for that examination. Letters of recommendation. You need to get letters of recommendation, 3 to 5. One of them needs to be the dean's letter. This is when you're applying into oral surgery. Okay. Most applicants do ask an oral surgeon to write their letter of recommendation. Makes sense. I had all except for one. I actually did have a periodontist write one of my letters of rec because he was I was very close to him. He was a mentor of mine through dental school. I did research with him. Dr. Romanos, he's fantastic. Great guy. He's a gentleman and very, very good friend of mine too. You know, a great mentor. So you don't need oral surgeons is the point of this. You can do others. Externships. What's an externship? It is not an internship. Right now, technically, because I'm in my first year of residency, I'm an intern. Externships or an externs, you do that during dental school. It's when you schedule 1 week to shadow an oral surgery program in person, right? You go there, you spend a week with them. Some programs have you spend 2 weeks, do a week. You spend, I did 1 week at Montefiore first, then I did 1 week here at NYU, and then I did 1 week at VCU. That was my externship trail. Magic number is 3. And I know this because, not because I did it, but because on my trail, I asked every program and residents at this program, what's a good typical number to get in externships when you apply to an oral surgery program? And they all said 3. You could do more. It looks good, right? But I would base it on your self-awareness on how your application looks. And we can go into that further later on. Extern at reach programs. Don't extern at safety programs. Go for the reach school, because if you make a mistake, they don't vibe with you. You didn't know if you were going to get an interview there anyway, so it's okay. If you think about this, if you extern at a safety school and you don't vibe so well with them and you don't get an interview there, you just messed up one of your chances to match to a program. All right. You schedule these with the program coordinators. Research, it's not required to apply to an oral surgery program. Some programs like it. Some programs don't really care. I would say the 4-year spot isn't as serious about finding applicants that have done research as is the 6-year. So on some 6-year programs like to see that you've done some research, you've done publications, and you're avid in the research space. Interviews. You'll get an email about what programs, and then you'll probably have a phone call with them. They'll schedule it up, and some interviews have multiple interviewing days to pick and stuff. My year interviews were virtual, which I knew would allow me to get to more interviews, which meant I was able to apply to more programs. If you understand that. In previous years, if interviews were all in person, some may conflict with each other. If they're virtual, you could technically make 2 things in 2 days. But if you're in Oklahoma and you have an interview in New York the next day, that's hard. All right. Just to keep in mind. End of January. That's when match day is. It's about a month after or more, month to a month and a half after your last interview. So a lot of applicants right now, if you're considering this year's cycle, they've just finished up most of their or all of their interviews. And now they have just over a month to wait until match day. Match day is a day where you get an email from the, I don't even know what it's called, but the place, it's like the website, the portal that you apply to all the programs, and they say you've matched to here or you have not matched. All right. It's a big day, make or break day. This is my Instagram, guys. You can follow me there. You could DM me there, reach out, anything you want. Let me know. Any way I get help, let me know. And without further ado, this is my grandmother. She passed away about a year ago. Actually, it was a week after match day, and she did get to find out that I matched NYU. She was very happy, and that was a very happy moment. This was from my white coat ceremony, and she was there. She was walking at this time, and still, as you can see, very lively, and so that was a special moment. Thought I'd share that. So let's go to Q&As, guys. I'll go back. Let's go right into the Q&A. Let's start it off. I want to be able to answer your questions. Could I just exit this? Doesn't matter. Let's open up the view so I can see everyone's face.
Yeah, you can absolutely end the slideshow if you want. Yeah.
Yeah. So yeah, let's hop right into it. The whole idea of the Q&A, I like to take the approach is that any questions you have, as far as mentoring, the programs itself, the process, how to go from dental school to it, how to go from undergrad into dental school, anything you want, let's go right into it.
Awesome. Okay. So thank you, first of all, for like the amazing presentation. And that was wonderful. Also, my Wi-Fi is a little bad, not gonna lie. So I might have to turn off my camera at some point. But I don't know if you can even hear me, but okay. But we can start off with our pre-dental student. So I kind of want to hear about like your undergrad. Oh no, were you able to hear that?
Cut off a little bit. All I heard was undergrad experience.
Yes. Okay. I'm sorry. Let me turn off my video because that might help the Wi-Fi. But anyways, basically, yeah. So most of our viewers right now, they are undergrad students. So I was thinking maybe we can start off with your undergrad experience and kind of move from there.
Sure, let's do it. Okay. My undergrad experience, I went to undergrad at two different places. So I finished high school at St. Anthony's on Long Island in Huntington. And I did my first 2 years at NYU Polytechnic Institute. It's now NYU Tandon School of Engineering. And I went there. It's in Brooklyn, actually. It's not Manhattan. I went there because I was recruited to play basketball there. And I also knew that an NYU degree would be very, very beneficial. I also like the thought of not really doing a pre-med or pre-dental major, because if you don't match, if you don't get accepted into a medical school or dental school, what are you going to do with that, right?
Yeah.
So I really wanted to apply my major into a career, a field that has jobs. And that's very important. That's probably what people should be thinking of when they apply to a college. How is the college going to benefit the rest of my life? Yeah, it's a good time. It's really important to experience this. It's also really important to think about what you want to do for a living, right? And what actually has jobs out there. Engineering is even tough. I could go into that anyway. So I did 2 years there, played on the basketball team and managed schoolwork, which was really important because I started to get the understanding of time management. Very important. I wouldn't be able to do this if I didn't have time management off a residency. I just got home half hour ago. NYU cut off the poly basketball team, right? It was two different teams, but they cut off the engineering school team and said, you could try out again for our team, but no guarantees. And I was like, what the heck? It's a good experience to balance work. So I transferred to Stevens. I was on the team for a year, decided I had a really good opportunity to do research with one of my close teachers that I was close with. And he was great. I was able to get research in undergrad. I started preparing to take the DAT. And that was the point I differentiated. I was like, okay, I'm not going to go for medical school. I'm going to go for dental. And I probably wouldn't have made as thorough decision if I was on the basketball team still in my last year.
Gotcha.
I took a gap year because I wanted to, I graduated and I hadn't taken the DAT yet because it was only 9 months before I decided. So I graduated. In a month and a half, I took the DAT, all applying at the same time.
Wow.
Had my interviews in the fall. And then that year, my gap year, I spent my time working for an oral surgeon, which that's where I figured out like, I kind of like this. And being mentored by an oral surgeon and other dentists. I spent time reading up on finance books, doing, learning about stocks, investing. I worked 2 lifeguarding jobs on top of oral surgery assisting, little music production, some fun stuff there. It was a good time to build self-awareness. So that's my journey. Oh, and then interviews. I applied to 6 schools. I got interviews at 5. The only one I didn't get interview at was Florida, but they take 90 something in state. So that's expected. I interviewed at Stony Brook, obviously, Rutgers, NYU, Buffalo, Toro. I think that's all 5 that I interviewed at.
Yeah.
Got accepted at all 5, chose Stony Brook for the reasons I mentioned before, and I'm here today to help you get there.
Wonderful. That is amazing. Okay, so I'm gonna kind of go a little back and maybe talk about the DAT, because a lot of our followers are, studying right now for the DAT or, about to start, and kind of maybe if you want to share your experience, how you studied and kind of your take on the DAT, I guess.
Sure. Something that I still use to this day for studying, when you're doing your course, your trail of studying for the DAT, you're going to get questions right and get questions wrong, or you're going to learn new facts that you didn't know before. I was writing out every little fact on a separate tiny index card. And I would go to the gym the next morning at 6 a.m. and I would sit on the spin bike for like an hour and just study those cards. I'm here to tell you that I use Quizlet now. You could put figures on it and you could all on one thing. We didn't have this back then. And if it did, I didn't hear about it. It's literally a game changer. Quizlet is how I succeeded in dental school. And I wish I knew about that. Especially the figures part, because I'm not going to draw, like a whole bunch of things on an. So yeah, that's a huge thing. You want me to go into how I studied for it?
Yeah, sure.
So actually during winter break, I studied, as you guys know, the PAT, right, is very different from anything else on that exam, right? Anything else you've seen, there's no class in dental school on the PAT, right? You got your angle ranking, you have cube surface counting, you got the hole punches. So it's completely different. I didn't want to wait until the summer when I knew I was going to study for the bulk of the DAT to learn that for the first time. That's going to be something that you want to be a clean, fresh mind from. You didn't just graduate college, After graduating, I knew, okay, this is review time. So what I did was I pushed up Crack the Dat for PAT, for the PAT. That's when during winter break, I spent my winter break learning it in and out, focus on one thing, prioritize things one at a time. It's very, very helpful when you do that, because then you're not going to get distracted by other things at the same time. I learned that thing in and out. And I tell you, when I finally got to DAT boot camp, I never got less than 26 on the PATs, the PAT practice section. And I was proud of that. Right. And I did very well on the DAT, and you will too. That was a great resource. So let's go to the summer now. I finished Crack the Dat, everything there. Gen Chem and Orgo, and guys, this is 5 years ago. So take all this. This was 6 years ago. Think about it, because one gap year, 4 years of dental school, and now I'm halfway into this. So this was 5.5 years ago. And I'm trying to talk fast so I can make use of most of your time, right? I want to make sure I give you everything I got. Okay, so Orgo and Gen Chem for Crack the Dat Pat. Number one there was PAT, Crack the Dat Pat. Next, an AP Bio book is really good, because they're going to really hit the high yield points, the key points in an AP Bio book. And you're going to need to learn a lot for bio in there. The next thing was DAT Bootcamp to get practice exams in. They only had 5 at the time. I wish they had more. Do they have more now? More practice exams in DAT?
What?
Like full DAT practice exams?
Yeah, they have 10 now. I'm
10.
pretty sure when I took it, they had 10 practice exams. Yeah, they definitely have more now.
You guys should be getting 40s on this thing. That's big. That's big. So that allows you to actually start studying for that portion, like practice testing at an earlier time, right? That's really important. Good to do that. Let's see. Orgo. There's DAT Destroyer. That's a big one that I use. And there's one more I might be missing. Is there anything that would you guys want to throw it out there? Let me see if I remember it, or any other questions you have specifically on it.
Oh, like QR, like quantitative reasoning, and then the reading comprehension. I think those are the other 2 sections.
Those are the other 2 sections. Quantitative reasoning, yes. DAT Destroyer for that. Very big.
Okay.
Also math problems. There's definitely a resource that's out there right now where they go through those. It's QR was harder than I thought. That was one that kind of caught me by surprise. Don't sleep on that one. The reading portion, if it's still the same, oh my God, very easy. Very easy. Like you finish that with time left, right? So I would literally go all in the basket on bio, quantitative reasoning, get a good PAT score. Spatial arrangement, believe it or not, is probably the most important thing for dentistry. right? And now I'm seeing it because you need to visualize a tooth. And just today, I took out a tooth. It took like 45 minutes.
Mhm.
It was broken down. It was a root canal. It was sticking to the bone, and it broke off in fragments. Not all teeth come out in one piece, right? And you need to have a very good visual,
Mhm.
spatial understanding to get out all those pieces.
Gotcha. Awesome. Thank you. That was very helpful. So now we're kind of going chronological. We can kind of move into dental school. And if you don't mind, maybe like sharing like every year, like kind of maybe at your specific school or just in general, kind of what each year of dental school entails for like a typical dental student and like what to expect.
Yeah, yeah. So dental school is typically, in general, right? There's every school is different, but in general, the first 2 years are didactic, right? In the class, studying, taking tests, learning how to perio probe, all that. The second 2 years are more clinical. You're in the clinic. You are working on patients. You're seeing patients. That's the general landscape. Some programs in the didactic years, Columbia, Stony Brook, they pair the dental students up with medical students. I think Harvard does it as well. Buffalo does not. Rutgers, I'm not sure. I don't remember. NYU does not. Toro, I don't remember. Just to give you an idea, right? If you're studying for the CBSE, some say it's beneficial to take classes with medical students. I'd say maybe, but the fact is, whether you do or not, you're going to have to learn 90% or more of the CBSE on your own anyway. So does it actually matter? It didn't matter for me personally. I had to figure out how I learned and then learn it and then study for it. So first year, it's all classes. It's all classes. We started about the middle of second year in clinic, seeing a patient once every other week, once every other week. It switched up for a while. It was a little weird. Just doing basic exams, like getting a patient in. Hey, so what's going on? What problems do you have? Chief complaints, sending out a medical history. Something you do in like 15, 20 minutes now took like a 2-hour visit because you have to get checks from doctors and they have diabetes. I got to get numbers and stuff. Taking x-rays, cleaning the teeth, prophies, perio probing, perio exams, taking a periodontal evaluation. A lot of it is diagnosing it and explaining it to the teachers in an academic level. Then you get to third year, you're in the clinic much more, like 3-4 times a week. And then by the last year, you're in clinic just about every day. And you're still taking classes. At Stony Brook, it was classes from 8 to 10 in the morning, presentations, classes, and whatnot. And then 10 to 1 was clinic and 2 to 5 was clinic. So if I could recommend one thing, enjoy your undergrad days, because those are some of the last days you have all to yourself. Yes, you do have classes. Some classes you get to go to or not go to, right? But when you get to dental school, that entire day is given up. Think about it. From 8 to 5 every day, you're going to the clinic. Some classes are virtual. So sure, great. You get to spend at home. But then you're working on patients and you can't be home for that.
Awesome. Thank you so much. Now I was gonna like ask a question about kind of the specific like residency you chose and like what was like the main like contributor to like deciding like oral surgery for you?
Yeah, deciding oral surgery. I come from a very team-oriented background, having played basketball, high school, college, other sports when I was younger. And then in dental school, well, I knew from shadowing and assisting an oral surgeon that I was very interested. It was exciting. Every patient's different. You see so many things in one day. You have a lot of time. It's the best surgeon to be, in my opinion, because I've worked with, I was on anesthesia. I just finished 2 weeks ago, and I was doing full on anesthesia cases for other surgeons in the hospital. The oral surgeon, I think, has the most time, the most control over their schedule, how much time you need to see patients and stuff, and the most time spent with family at the end of the day. I truly believe that you get to give your all to your family as well as give your all to your profession. what solidified it for me in dental, I knew I wanted to do it, but I was very open-minded to other specialties. What solidified it was externships, spending weeks at other programs, being a part of that team experience again, planning procedures. I mean, I was only assisting, but I was helping out everywhere I could. That really solidified it. And I wanted to be a part of that team, mentality, that team attitude once again. And here we are. Did you want me to go into programs like why I picked NYU and stuff?
Yeah, if you could, that'd be awesome. Yes.
Sure. I mean, well, let me start with when I say pick NYU, oh, come here, you little cutie. This is Nico, by the way.
Oh.
He just ate. He's feeling fat because he is. Got a fat little belly now. When I say pick NYU, I ranked it first and got here, but you don't know what programs rank you or how they rank you, right? So when I say pick NYU, I ranked it first and I got lucky. I'm very fortunate to have gone here, but I could have ranked to my 3rd spot, 5th spot, 15th spot, and that's still lucky, right? Where you match is the place for you. That's very important to remember, right? It's a privilege. I liked NYU because there's a lot of autonomy here. Want to go back? All right, little fatty, little cutie pie. There's a lot of autonomy here. A lot of programs, they have the attendings do the surgery. I wanted to be at a program where you learn from the attendings, but you also do a lot of the surgery. Some programs don't have that. And NYU has a lot of that, where they teach you early on in residency, and then you're doing a lot, like you're the boss later on, right? And when you get out, I think you want to be comfortable with being the boss.
Yeah, for sure. Awesome. Okay, so my next question is with oral surgery, I know I'm familiar with some common with some common cases you would do, obviously wisdom tooth removal. Even when I had mine removed, it was done by an oral surgeon. But what are some other cases that people might not be familiar with that oral surgeons do, and kind of maybe pick one of your favorites and kind of, if you can, walk us through what a typical procedure would be with that case.
Sure. So while oral surgeons do a lot of implants in private practice, some of what they call the bread and butter, like the typical oral surgery treatments, would be wisdom tooth removal. It would be sedations, right? Because there are only 2 dental specialists that can do full sedations, right? So not general anesthesia. You're not in the hospital setting. You're in a clinic setting. It's called max sedation, monitored anesthesia care, where the patient's taking a nap, in a twilight sleep. They're not fully asleep, but they're deep enough where they're not aware of what's going on at all. They're breathing on their own, etc. So that's really important, because some procedures it's good to go to sleep for, right? It makes it less traumatic for the patient. Implants, wisdom teeth, bone grafting, where you put bone particulates. Some people do block grafting in order to prepare for implants. For example, in the future, sinus lifts, where you take bone grafting and you go into the side of someone's maxilla, and where it's really thin, and then you, underneath the Schneiderian membrane, it's the membrane of the maxillary sinus, you push bone grafting material in there to push it upwards, in hopes that if it heals, the bone level's thicker for example, an implant. What we don't do is dentures. We don't do crown preps. So those are other dentists. We don't do root canals and endodontists. In the OR, in the hospital setting, this is under general anesthesia. We don't do the anesthesia for these. We have a separate anesthesiologist do this. Osteotomies, for example, BSSO is where you split the mandible on one side or both sides, and then you either bring it forward in order to correct the profile. For example, retrognathia is when the jaw is sunken far back. So you want to bring it forward. So you split the jaw on either side, being very careful to not damage the nerve. And then you bring it forward, you slap some plates on either side, and you secure it in place. Okay. A Lefort 1 osteotomy is when you cut across the maxilla, and then you either bring it up, you bring it down, or you rotate it. You bring one side, like say, for example, the front down and the back up, in order to match the mandibular rotation. And what's the point of this? It can correct TMJ problems. It can correct your aesthetics, right? Your side profile. It can correct your smile. It can correct obstructive sleep apnea at night. If, for example, your chin is so far back that when you're laying on your back at night, it's cutting off your airway. It can correct that in some cases, among a number of others, right? It's a very, very invasive surgery that has to take place in a hospital setting.
Awesome. So like, do you see yourself like in the future doing more clinical stuff, or would you ever be interested in taking the hospital approach, or do you prefer clinical?
The hospital approach is amazing. I mean, the things that we can do in oral surgery is it's God's work. I mean, and it's such a fortunate procedure. I personally see myself more in a private practice setting because I think I really want to get involved in the community. When you're working in the hospital, you see a patient once, you procedure, and then they're gone, right? And I like the community feel. I really want to get involved with the community. Like, hey, like working with orthodontists, other dentists, kids when they're coming in, get their wisdom teeth. Hey, and oh, mom has a dental problem. Okay, well, if you want me to take a look at the paint, you see if with the tooth, things like that. Another thing is, I see myself in academia in the future, just for like a 1 day a week. It's very common for oral surgeons to work part-time at residency programs and dental schools. I would totally see myself doing like 1 day a week on a Monday, getting involved there because I have a passion for mentoring. That's why we're here today. And I like teaching and interacting with younger and older professionals like you guys. And that's one thing. Also, interestingly enough, not to get too much into this, but I don't feel insurance companies reimburse the biggest procedures in the world enough. And I'd like to see insurance companies kind of get their act together, honestly, get their act together. And when, doctors tell people it's literally a life-changing thing so that they don't have obstructive sleep apnea, I don't think it's fair for insurance companies to tell the doctor that patients don't need procedures. I'm very, very, I think that's very important, right?
Okay. Yeah, for sure.
So I don't know, side note.
No, I like that. I definitely like that perspective. That's such an important thing within the dental field when you're dealing with patients. Like insurance is such an I really actually personally I think that's very interesting.
It is.
So
It's
thank you.
sad.
Yeah.
I mean,
Yeah.
I was on the phone for an hour and a half yesterday arguing with insurance company because it's like, what do you mean that? Okay, just I'll change the code on the thing, but I'm wasting time talking to you when I could have treated 15 more patients. Or, for example, these doctors are putting their life on the line in hospitals right now.
Yeah.
They're spending days in the hospital at a time. They're doing these procedures that is literally life-changing for patients.
Yeah.
And then they have to spend an hour and a half when they want to go home and like spend time with their families or maybe recover for the next day's surgeries. And they're spending time arguing with insurance companies half the time. Yeah. There's a problem. And I think it would be nice, and maybe through academia or whatever, it would be nice if we can get doctors broad scope to do the procedures they want to do, the things that they're talented at.
Yeah.
Help people. Stop arguing. They can't be arguing with insurance companies. This is a side note, but it's just something I'm passionate about because I think some changes need to be made in the patient's interest.
Yes, of course. Absolutely. I agree. I feel like the patients are always first. So I absolutely agree with that. Thank you for sharing that. Yeah. I guess you did touch upon private practice, and I know a lot of future dentists, like there's always that choice, corporate dentistry or private practice, or, even hospital settings. But if you could maybe touch upon like your future plans, I know it's like definitely later on, but like, how does one even go about like maybe starting a private practice? There's a lot of business to it. Of course, like there is the health dentistry, of course, that is the main part, but the business and starting all of that, that's also huge. So how does one even start that? And like, what can we do as pre-dental or even dental students to kind of get ready for that?
This is a loaded question, right? Because private practice and corporate dentistry they're two separate things. They're mixed. There's some private practice and corporate, there's corporate and private. Very interesting. But at an early level, what I would recommend is take some classes on business and in marketing in undergrad, right? Why would I say this? Because think about it. Dentistry is a trade. If you're a dentist, you're performing services, your treatment planning. It's a service for a patient, right? It's a trade. It's a physical trade, right? Now, what does that mean? It means that that's the patient to dentist is a physical trade, which means that there's a business to it and there's a marketing to it. There's money to be made the business behind dentistry means like there's money to be made in it, right? Just to keep yourself going, to treat more patients, et cetera, et cetera. How do you get more patients in the door though? That's where marketing comes in. Does that make sense? The number one marketing historically and still is word of mouth, right? Because little Johnny tells, it was, has his wisdom teeth moved, and then mom needs an implant. Mom goes there. Mom tells Aunt Janet, oh my God, he was so great. He was great. And then Aunt Janet comes in, gets an implant. Hey, my sister Christy, she needs a root canal. Do you know who to talk to? Oh, my buddy. Oh my God, Dr. Scott. You need to meet Dr. Scott. He's the best root. So then you see how this number one is word of mouth, but this is marketing. Now patients come into the door, but the business behind that is what controls money movement. So offices open, offices close. There's the business that controls that. So the patient and patient interaction is the trade itself, but then someone owns that trade. It may not be the dentist doing the work. It may be another dentist, an older dentist, for example, that owns the practice with a younger dentist doing a lot of the work, or two younger dentists doing a lot of the work. Does that make sense as far as the business goes?
Yeah, for sure.
Right. The marketing side of that practice has most likely been inherited, has been previously established by the older dentist. So now the two younger dentists in this practice are doing most of the work, right? But the business is controlled by the older dentist, and the marketing is also controlled by the older dentist. So now, why is this important? I recommend to you guys to study marketing, and you don't even have to take classes on it. You could just study this and learn all of it online on Google and YouTube. When you're going to become a dentist or a doctor, for that, you're going to, in the beginning, work for someone else. Then you need to decide at some point, do I want to continue working for someone else and doing all the procedures they don't want to do, or doing all the procedures that make them money? Do I want to do this procedures I want to do, and do I want to make money for me, or do I want to make 50% of the money and then they make 50% of the money? Those aren't the fractions. This is an example.
Yeah.
Now, why is that? Why is it important to understand marketing and business? Because if you branch off into your own practice, what's going to keep that practice running? The business, right? What's going to get patients in the door? The marketing. So this is just very generalized, but it's very important to understand that. Awesome. Does that help? Dentistry is notoriously, it follows medicine by about 20 years. Medicine is over. Medicine is all corporate now.
Yeah.
And this is a side note, but who decides what procedures patients get in medicine? Is it the doctor or is it the insurance company?
I'm not sure. Is it the insurance company?
A lot of times it's the insurance company.
Okay.
Who does the procedure though? The doctor.
Yeah.
Who gets the blame when things go wrong?
The doctor. Oh my.
The doctor.
Yeah.
Who does media tell you isn't doing the procedures? The media, social media, everywhere. Yeah. Is it the doctor? But who decides? The insurance company. Who pays politicians and media to keep the pressure on doctors?
Interesting. The insurance company.
Is it the insurance company?
Yeah, I guess. Yeah.
It's a question I'll leave for you. So where do most of these doctors do most of their procedures? The business, right? Who keeps their practice going? Hospitals, right? Right. So the procedures the business, the business is run by insurance companies, but the procedures take place in the hospital. Remember, I'm using medicine as an example for you to understand this.
Yeah.
The business is owned by insurance companies. The hospitals where the procedures are done that most doctors take place. I'm not talking about plastic surgeons or dermatologists, right? They're separate. Let's take majority of medicine. So who owns the marketing of most doctors in today's day and age? The hospital. right? I'm sure you've seen everything's being bought up by these major hospitals, right? These institutions, huge institutions, NYU Langone, Mount Sinai,
Mhm.
Rutgers, Northwell on Long Island, LIJ. You've seen this everywhere you go, right, guys? So the marketing is owned by hospitals. The business is owned by insurance companies. And why is this important? Because they all take a piece of the doctor's money and they all take a control on telling the doctors what they're going to do. And why am I so passionate about this? As I'm sure you are too. This affects what patients get for treatment.
Yeah.
Who should be doing the treatment and deciding what's best for that patient? I think the doctor who's trained for it and ethically took an oath to do best for that patient.
Yeah. Wow. Wow. Thank you so much. Yeah, I completely agree. Trust me. I completely get that. Thank you so much for sharing that. I guess like since we're kind of on this path, and I think you kind of touched upon this, but maybe just a little bit more detail. Definitely true that medicine, a lot of like different medicine paths and practices, they are mostly corporate. We don't really see a lot of private practices, and I've heard this from other dentists as well. Do you think like the future of dentistry is completely going to follow that path, or is there a possibility, like I don't know, like how long will it take for them to be completely corporate, or is there some hope that there might still be like practices that are common, like private practices? I hope that makes sense.
Oh, it makes sense. And
Okay.
I don't want to go on, I don't mean to go on another rant, but
No, of course.
to kind of explain where this kind of came from, what's
Yeah.
going on, and where I see the future going.
Mhm.
So let's start with, so traditionally dentistry trails medicine by 20 years, give or take, right?
Yeah. Mhm.
And medicine, look, like it's completely owned by hospitals, insurance companies, et cetera, right? The majority of medicine, doctors don't own their practices as much anymore, right? And I'm not gonna lie, it makes me have a little worry that dentistry could be trailing that direction.
Mhm.
And now, why would it?
Yeah.
As the time goes on, we get better with medicine and treatments and stuff. People are living longer.
Mhm.
Dentistry, remember I said, is a trade. Your career is finite. People doing dentistry 50 years ago did it until they were about, say, 60 years old, right? Maybe a little earlier. Dentistry today, when are they mostly doing? Most people are doing dentistry until still roughly about 60 years old. But people are living much longer, right? And they need to retire. They want to. So, and this is half my theory. This is half of what's going on. Dentists are now, as they get older, they do less and less work, and then they put their money and they buy a second practice and they buy a third practice. And now they work less and they just manage multiple practices, right? And they make more money, although they're doing less physical work.
Yeah.
Okay, so that's what happened with medicine, right? And now they brought these big hospitals, bought that, rules changed off of insurance companies and such. But in dentistry, a lot of it stayed separate. A lot of it stayed separate for cosmetic reasons and such. So why is this important? We are going in a corporate direction, but as you have one dentist up top making a chunk of the money off of this practice, and this practice, and patients are going to all of them, the dentists don't make as much as when they own their own practice.
Gotcha.
And the guy at the top who doesn't do any work, he just organizes it all. He takes a cut. So dentistry becomes even more expensive than it already is. And the patient treatments gets more diluted. It becomes less focused. Then dentists can have less attention on each patient. This is what happened in medicine, right? Because they have to do the job that the older dentist wants them to do, but they still have to, and they have to treat more patients. They have to do more procedures they don't want to do. Okay. So how is this going to change? Because we're going a corporate direction because of business side.
Yeah.
What would have to change is collectively, hey, take it easy. Collectively, as dentists, we'd have to be in control of the marketing. We can't control some of these DSOs, the corporate dentistry, they're backed by hedge funds. We're not going to compete there, guys. You have to compete on the marketing side. I just threw out a lot of concepts. I'm not trying to get too complicated on you. If you could follow along, I tried to break it down. Does that make sense? Is there something I can answer more on that?
No, absolutely. That makes a lot of sense. I actually really appreciate you, like you sharing that. Like we don't talk about that a lot. And I think that's such a, especially if you are planning on, going into dentistry, it's such an important thing to think about. So yeah, that absolutely made sense to me. And I think hopefully our followers, like that was helpful for them because it's very helpful for me personally. So thank you so much for that.
Yeah, yeah, of course. I want to
Awesome.
go into private practice too. I want to work for
Yeah. Mhm.
older, more experienced dentists, oral surgeons, right,
Yeah.
for a number of
Mhm.
years. But I want to hope that I could become an owner at some point, right?
Yeah, of course.
Not to boss around younger dentists, but I want to be an owner because I want to make a difference in the world and such.
Yeah.
I think the corporate model doesn't allow for that as much, and it makes it less opportunistic to become an owner.
Mhm. Awesome. Yeah. Thank you. So now we can kind of take, a little turn. We can kind of go back to you and your residency. And if you don't mind sharing kind of like a day in your life, like as a resident at NYU, like what you do in the, like, a typical day and from like the morning to like the night, kind of, if you were to verbally explain that, and if somebody was to go through the day, how it would be.
Of course, of
Thank
course.
you.
So let's start with oral surgery, pediatric dentistry, GPR, so general dentists. I'm trying to think. I think it's just those three that take call.
Mhm.
Call is when I was on it 2 nights ago. I'm going to be on it for Christmas. So I'm not going to be with family. It's when you carry around a little pager and you get called in when there's if you're a general dentist, there'll be a general dental emergency, like a tooth got popped out and the kid goes into the ER. What do I do? Do I put it back in? If it's a kid tooth, pediatrics might get called. And if it's trauma, if it's some major dental things, if it's any facial trauma, oral surgery gets called, right? And I hold that pager, the interns hold that page. Well, you hold the pager for 24 hours, right? Right now, we have a mixture of I'm on call between every 3 to 5 days. So right now I'm on 3 days, in 2 weeks, I'm on every 5 days, in 2 weeks, it'll be every 3 days, etc. So that's something really important to keep in residence, because when you're carrying on a pager all day and you're in the middle of seeing 3 to 5 patients all at once in between different rooms,
Yeah.
and then you get a call while you're telling Mrs. Rosanna that her daughter needs to go back to her orthodontist to get more teeth pulled, it gets very busy.
Yeah.
So also oral surgery, I told you, you have hospital patients, and then during the day in the clinic side, there's the hospital patients that are in the hospital. Then you have the clinic patients that are getting a couple teeth removed, bone grafting, implants, wisdom teeth under sedation. That's a clinic. That's an outpatient. You have inpatient in the hospital. Outpatient is the clinic in oral surgery out, right? So you're an outpatient all day. At the beginning of the day, though, you need to what's called rounding on your inpatients at the hospital. You go to see how they're doing. Has their condition changed? How are they feeling? Do they have any important lab values that you need to? Has their potassium gone down? Right? Things like that. You do that in the beginning, way early. It could be as early as 5 o'clock. You round on a couple patients, and then you go and set up the OR as an intern for the chief residents, chief and senior residents. Set up the OR for them, get them the gloves, set up the table, make sure the patients are ready. Are the consent forms in? Did they get COVID testing? So now that's from like 7 to 9, right? 5 to 7, you round on the patients. 7 to 9, set up the ORs for them. 9 until 4 to 5, you're in clinic all day. You might not get lunch. I didn't get lunch today. At 5 o'clock, 4 to 5 o'clock clinic ends. What are you going to do? You have to round on those patients again. All the patients that are still in the hospital from days prior, and the patients that are still in the hospital from the procedures today. That could take anywhere from 15 minutes to hour and a half. See how they're doing. Then if the chief residents, senior residents, they go home. Interns, now they have to do paperwork to prepare for the surgeries the next day. You have to do COVID testing because it may not come back. You have to do that a few days in advance. So now you call the patients for COVID testing that are getting procedures in 3 to 5 days.
Yeah.
You're doing all that paperwork. You're planning all that for them. And that's why I got home at 7:30. That could be an early night, by the way, on some nights. And if you're on call, you might not get home at all.
Wow, it's very intense. Oh my gosh. That just really puts it into perspective. Not gonna lie, that's very intense. Oh my gosh. I literally complain about walking to class. So I really commend that. I'm sorry. That was so, yeah, that's wonderful. So given all of that and like just, stressful situations, I guess like I personally am a really big like mental health advocate and making sure you check in on yourself and like even like undergrad to like dental school now to residency for you, are there like some things that you feel like have made sure that helped your mental health and made sure that you were able to check in on yourself and make sure like you're doing okay even when you're like stressed about like everything else that might be going on, if that makes
Sure.
sense?
Yes, it makes sense. I'm going to help you right now with mental health. Okay. When
Awesome.
things get tough, and things will always get tough, they will always get tough.
Mhm.
Things will be tougher in the future. Every tough experience is a learning experience for you to see how you handled it. What was actually prioritized in this situation? How did you prioritize it? Okay. There's going to be a million things going on at once. You're going to get really stressed. You need to break that down into separate things. Write it on a list. I use To Do. It's an app by Microsoft. It's a to-do list and a calendar. So you could prioritize everything and then set it to specific dates you need to get it done by. And it synchronizes between all your devices. Why is that important? You prioritize everything you need to get done. Do the things that need to get done now. The things that need to get done today, later. Then the things that need to be get done tomorrow, the next day in the month, right? Push them off to tomorrow, right? You need to prioritize. Now you just filtered out 75% of your things. Focus on the 3 things you need to do today. And don't forget about yourself. The last tip for this is prioritize. Take action. You need to knock off the things that are causing you stress today. Then you need to keep the things to yourself. Some people like to play the piano. Play the piano for a half hour. Yes, do it. Some people like to eat a lot. Well, at the end of the day today, I didn't get lunch, so I stuffed my face and hopped on this call. Exercising. If we didn't have this call, I would have gone to the gym. That's very important. Get a 20-minute run in. Do yoga. Oh my God. Yoga is great. Sit in the sauna. Some people like to swim, run, bike ride. Peloton's a big thing these days. Things like that. Spend time for yourself. Exercising is a great way to reset your mood. If you just organize and prioritize your stressors, you took action on a few of them, took a break to change your mood with exercise, and then knocked off the last 1, 2 to 3 things afterwards, I can guarantee you by tomorrow, you will have restructured your entire outlook on your week. All right.
Yeah. Thank
Does
you.
that
That was
help?
amazing.
Of
Yes,
course.
absolutely
Yeah.
helps. Thank you.
Great.
Um,
Hey, anything I can do to
I
help?
Yeah, thank you so much. So we are like almost hitting the 1 hour mark. So I guess like this can be like the last question. And
Sure.
it's not really a question, but like you've given such wonderful advice like for this whole presentation. So again, thank you. But I guess like my last thing I would want us to like hear about is kind of, like one last thing you want to give, like a last piece of advice or anything you just want to like leave us off on, or just anything kind of like, I don't know, like I don't know. I guess like just some advice. That would be really appreciated. Yeah.
Yeah, of course. Okay, I got 2 more minutes. Let me finish
Okay.
with something profound. Remember that everything we do every day we get is very fortunate, right? And I start off the presentation showing a picture of my grandmother, and it really puts life into perspective. Every day we see patients that may have a tumor. That tumor may be benign. It may be malignant. My grandmother had it was breast cancer in 2001. It went away, and it came back in 2016 as lung cancer. Okay, so from the get-go, she was on the clock. We're all on the clock. You don't know how long that clock's going to go, and some people don't get a second chance like my grandmother did. The point of what I'm saying is, no matter what you want to do, you can do it. You need to take the action. Like I mentioned before, you need to take the action and prioritize steps to getting there. If it is oral surgery, you may be told you can't do oral surgery, but if you want to do it, you need to take the action to get there. All right. Talk to mentors. Mentors are also a big stress because they put things into the bigger picture. Follow the footsteps of your mentors. And you don't have to do everything. Do what you like, right? Another big thing, I'll end it on this. A lot of times in undergrad, you'll find there's a lot of stuff to do. Everyone's like, not sharing help, not studying together and stuff. You want to get into dental school, you wanted to get into oral surgery, orthodontics, very competitive fields, type A people, go, 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 me. I want to do it. Of course you do. But be a team player. And no matter what, always do the best you can without changing your personality. Because at the end of the day, what I found out on my interview trail, the number one thing, people understand if you're a good person. Be a good person always. Work with others. Work hard for yourself, work hard to be in a team atmosphere. I mentioned a whole bunch of topics. I'm kind of bouncing around here, but the whole point is that make sure when you try hard to accomplish your goals, be yourself at the beginning and the end of the day. Don't try to be someone else and don't try to be consumed in the stress.
Wow. Thank you so much. That was so inspirational. Personally, oh my gosh, thank you so much.
I hope it helps,
Yeah, no, it truly helps because a lot of times we get like caught up in like the moment, especially, it is so competitive and it's just going to get more competitive. But I completely agree. Like it's so important to like stay true to yourself and all of that. So thank you so much for sharing that. And I guarantee you, like people found that very helpful. So thank you so much. So yeah, we have hit the hour mark and I guess I can conclude now. And thank you so much, Dr. Gallagher, for like giving up your time. Like I know you had such a busy day. You didn't even have lunch. So thank you so much for joining us. It's like so appreciated. Like I thank you so much. That's all I can say. And yeah, thank you everyone for watching. We'll have the quiz up shortly. So make sure to click the link in our in our Instagram bio. So yeah, thank you so much.
Thank you guys. Thank you guys for having me. Really, I know that, this means a lot to me too. All right. I appreciate you for listening to me today and you guys will all do it. If there's anything else I can answer personally, DM me on Instagram. I do respond to everything on Instagram except for spam, but anything I can do to help, please let me know. All right, guys.
Of course. Thank you so much.
Thank you. All right. I got to hop. We'll talk soon.
Bye.
Bye.
Okay. Awesome.